2017, the Australian Healthcare and Hospitals Association began some work on a blueprint for a healthy Australia, healthy people, healthy systems, and we put forward in that blueprint 4 domains that needed to be addressed in order to really transform the way we deliver healthcare in Australia. Those were governance, funding, data and workforce. We've had 2 years now to advocate for health system reform. Today we've met in Brisbane to discuss the work that we will do at AHHA to progress the Healthy People, Healthy Systems blueprint. We had a great honour of bringing together members from across the country at Brisbane Airport in the Convention Centre in a lovely setting to start having some really focused discussions. First, hearing from keynote speakers. We started off with Michael Brennan, Chair of the Productivity Commission.
And that culture of waiting arguably symbolises the general passivity of the system. Patients have to present to the system rather than the system seeking people out to help them proactively manage their health.
Ian Symonds, President of the Medical Schools Deans across Australia and New Zealand. We also heard from Shelley Nowlan, Chief Nurse in Queensland Health, on work they're doing on care navigators. Then we heard from Professor Sue Evans from Monash University on clinical quality registries. And lastly, we finished up with Dr. Rob Grenfell from CSIRO Health and Biosecurity, talking about the future-looking work that CSIRO are leading. We also had some great input from AHHA members and stakeholders around the types of issues we might want to explore as we develop that part of our blueprint in more depth. I'm looking forward to working with working groups across Australia over the next year to really bring some of those ideas to maturity and put forward some really valuable propositions and ideas so that the Australian government, the state and territory governments and health service leaders can start to implement some of that thinking in their work.